Welcome to our second segment of our Alzheimer video journal. It is clear in Alzheimer's disease that an individual is affected by the disease, but we also know that the whole family is affected. In this segment, Bo and Colleen will be talking about some of the challenges that they have faced earlier on in the course of the disease and how the family has navigated through those challenges.
I would say about probably a year ago I started noticing, and probably one of the first things I noticed was that I did not seem like I was having patience with her. And I thought it was me, that I didn't have patience.
Okay.
And then I started noticing some physical changes, where there was changes in how you were walking.
Yes.
So I noticed when we'd be walking, number one, she'd be hanging back and almost walking right behind me.
That's right.
And I would say, come on, come walk beside me. I can't see you, right? And then I noticed she was, her feet were slapping on the ground. And then I noticed when she would be just at certain periods, whether she'd be watching TV or doing something, she would be just kind of in a daze. And I would say those were probably the main things that I started noticing at first. And there was another thing, just constant repeating on some things. So not one or two times, maybe 10 times, 15 times, repeating things. She drank water, right?
Right.
I had my snack, right?
Right.
I brushed my teeth.
That's right.
I cleaned my glasses. That's good, right?
Right.
So when we came for our appointment, which we come every 3 months, when we came right before Christmas, that's when I said to Janet, okay, Janet, I've been praying for more patience. And so then I started telling Janet about that, right?
That's right.
And then we started telling Janet about your repeating. And then I thought maybe there was a hip or a knee problem because of the change in the walk. So we went through all those things, didn't we?
That's right.
And then Janet said that she thought maybe we needed to start on some medication for Alzheimer's, which was surprising, shocking.
That's right.
And we ignored Janet because Christmas was coming, right?
That's right.
And we thought, no, it isn't true.
That's true.
It was true. Yes, it was. I'm a nurse. Knew that this diagnosis of Alzheimer's was a big possibility. But when the symptoms started happening, absolutely did not put it together. We were on such a upward climb and have been for the last 17 years that it was it just stopped me in my tracks. And so I was very much in denial. So then we came back after Christmas and I saw a real decline in that time, and it was startling. So I knew we needed to start on some more medicine.
That's right.
And so we started on the medicine, right?
Right.
And it was truly amazing to watch how the old Colleen was coming back. We started on the medication, and I have to say probably within 2 weeks we saw a real improvement. The gait was better. The repeating was a lot less, right?
Right.
And then nurse had more patience, right? Was I better?
That's better.
Did you remember it was my birthday?
Me too.
Yeah? What did you do?
I know.
Well, tell them. What did you do for my birthday?
It's my sister. I forget. Had a birthday card.
And what did you do?
But I guess it's my sister birthday card.
Birthday card? What else did you get me?
Zero.
Sprite Zero?
Oh, that was nice.
Tied it in a bag, put it on my chair.
Yeah. Underneath the chair.
I was like, whoa. Surprised me. I couldn't believe it. Now we were a couple days late. I don't want to say that. That's all right.
Right.
Once she saw Saul's birthday card to me and asked me, what is that? And what did I say?
That's you.
I said, it's my birthday card from Saul.
So,
And then she went in full gear, hunting down the birthday card in my desk, finding a present, you spent about 45 minutes getting that ready last night, didn't you?
that's right.
And that was fully on, fully alert. But on my birthday, that was not such a good day. So, whereas she would have gone right to doing, the whole birthday went over, where never would that have happened in the past. What do you do for exercise every day?
I walk.
45 minutes every day?
Yeah.
Yeah. When we've gone and stayed at a hotel, a different treadmill might look just like our treadmill, but
Right.
it's kind of scary. That isn't our treadmill, where you wouldn't think it would make any difference, and whether it's the surroundings or it's a little different, but she does hang on when she walks a little more than, probably all the time, than she used to not hang on when you walk. In the past, when we went to hotels, and we always still exercise, right?
Right.
Wherever we go, that it didn't make any difference that the treadmill was different. Once I oriented her to that treadmill, then she didn't have any trouble. And what I've also learned is if she's very obstinate on something, there's a reason for that. It isn't just being stubborn. There's a reason for that. So I was starting to see, when we would go stay in a hotel, she didn't want to do the treadmill. My thinking was she just didn't want to exercise that day, right?
That's right.
But that wasn't the case. Once then I realized it was more about stepping up onto that machine that maybe was a little different. It was in a different environment. That's what made the big difference. Do you remember things, or do you have trouble remembering?
No.
Sometimes?
Sometimes.
Yeah, sometimes. What year did you graduate?
84.
84. Now, when you graduated, what did we do?
Got my high school.
From high school, did we have a big party?
Yeah.
And what did you get at the party?
I know.
Do you remember?
Oh.
What was that?
I see it. Oh. Not need to give me about Coke Zero.
Well, not a Coke Zero, but what did you get?
I see it.
Trophy?
Trophy.
Yes!
Right here. Trophy. The big trophy.
A big trophy, cool.
And that just reminds me, that's one of the things that I do see is sometimes struggling for the word of what she used to be able to come up with right at the same time.
That's me. Not my hair.
Look at her hair.
That was
Man alive, we had
that was
some
pretty bold.
hairdos.
That's me.
That's you. Good hairdo? We all had those hairdos, didn't we?
How have these changes affected your family?
I would say overall, it's not to the fact of we haven't changed the way we're very active. That's a lot of weekends. We're going and doing something, aren't we? You work every day, you come home, you exercise. Sometimes you've got things to do in the evening. We have things to do in the evening. So I think when the diagnosis first came, it was kind of stopped us in our tracks thinking, okay, we need to change life. We need to kind of adapt to things. And in thinking about it, we've decided not to do that. So when we go to do things, for example, I'm very cognizant of offering my hand or my arm to her, because when we walk, whether it be in a parking lot or anywhere that she's not familiar, the depth perception, which was another change, has her perceiving depths on steps and curbs and cracks or lines in the sidewalk has changed. So I can see her hesitate, and so instead of making a big deal, I just offer my hand or arm, and everybody in the family is cognizant of that. We had one fall, and that was enough for us to realize, and she'll hesitate. So we've changed with that. As far as what we do, we're not changing those kinds of things, right?
Right.
But just kind of adapting to it. I try to, if we've been going at different things, I try to slow it down so there's a little more stability, so she can have her normal going to work, coming home and exercising, making her lunch,
Right.
watching your shows.
Right.
That's what we do. So we've been on the medication, I want to say 6 months, 7 months we've been on the medication. And then we probably in the last couple months started to see some sleep issues, which have always kind of been there. And but we're getting a little more intense.
Right.
Your people bothering you at night?
No.
Not now.
No, no.
No, they're not bothering you at night. So we tried a little melatonin, and now we're trying something else for that. And sleeping, when she wasn't sleeping, the symptoms started coming back. The change in the gait, the repeating, right?
Right.
Slow walking,
Right.
daze.
Yes.
And then when you started sleeping, was it better?
I'm okay.
Do you feel better when you're sleeping?
I'm fine.
Yes or no? No? You don't feel better?
No. Nobody.
Oh, nobody's bothering her. So that's what we're trying to do, is get where nobody's bothering you at night, right?
Right.
Still, there's days when I see the symptoms in full force, and there's days that are great days. And sometimes during the day. Sometimes we have low points, and sometimes we have really good, meaning the low points are when I see the symptoms, when I see her not engaged in what we're doing. And then on good days, I see her totally alert to what we're doing. The strategies at the time is, again, bringing it right back to focusing on things that make her feel secure. So on those days, when I say I want to try to settle our life down a little bit, whether it's me being her main caretaker, I would not go do. If I had plans to go do, I might just try to not do that on those days because of her feeling more secure. But again, I try not to change our life. She's always adapted, and I don't want to start sheltering her. So back to that, I just try to, again, bring some balance into it. And that may be the eating, that may be the sleeping, that may be who is around her, routine things. My wish for families is to, number one, be really cognizant of those symptoms and changes that they're seeing in a family member, and number two, to relay those to your healthcare provider, and then also, if it warrants the medication, then to start on the medication with and just have early intervention with this, and then also to, once you've started it, to just not be hyper alert, but alert to changes, because whether it be their environment, their sleep, the people they're around, things that can throw their life out of balance, but just to then try to keep their life as balanced as possible.